There's a common perception that lung cancer only occurs in people who brought it upon themselves by smoking and ignoring the recommendations to stop smoking. But the fact is the vast majority of our patients are ex-smokers and did the right thing and quit smoking but got lung cancer anyway. Close to 20,000 people a year in the United States die of lung cancer who've never smoked, and it's certainly unfair to accuse them of inflicting this disease on themselves. I even had one patient who was diagnosed recently with lung cancer, and he smoked only during his service in World War II, when he was issued cigarettes as rations by the U.S. government, and hadn't smoked since, but still came down with lung cancer. So I think we have to deal with the problem of lung cancer in a way that doesn't blame the patient, but tries to help them with this disease. There are many things about how we live, what we eat, whether we exercise or not, that affect many health problems, all the way from coronary artery disease to obesity. And obesity itself increases your risk of many kinds of cancer, colon, breast, etc. And yet the people who are diagnosed with colon cancer aren't stigmatized because they weren't lean and exercised a lot and ate low-fiber diets. And so all of those factors play into the development of many types of cancer, and lung cancer just has, in addition, the stigma of smoking. But in fact, smoking also increases the risk of multiple types of cancer. The total number of deaths from lung cancer exceeds that of breast, colon, prostate combined, and it's the #1 cancer killer for women, with approximately 2 times the number of deaths as breast cancer, and the #1 cancer for men, with approximately 3 times the number of deaths for prostate cancer. And yet the amount of research funding per death is far lower for lung cancer than any of the other kinds of common cancers, about 1/10 of that of breast cancer. And philanthropic funding is much less for lung cancer as well, again about 1/100th the amount of breast cancer. And so at least one of the reasons for the low level of philanthropy, I think, is this stigma of blame that is attached to lung cancer. And as I said, I think that's unfair for the patients and is hampering research and improving the treatments for lung cancer.